My name is Carol Lee. I'm an emergency medicine physician who practices at the Arrowhead Regional Medical Center in San Bernardino County. Between 2020 and 2022, we noted about 36% rise in the incidence of syphilis, 3% rise in the rate of congenital syphilis, and about 5% rise in the incidence of both HIV and chlamydia. In response to that, Arrowhead Regional Medical Center decided to partner with the San Bernardino County Department of Public Health, and we collaboratively launched a program that aimed to not only reduce the incidence, but also to tackle the spread of the illness in our county. We offered early testing of patients in the emergency department. Regardless of their condition that they presented in our ED, they were offered an opportunity to be tested for sexually transmitted diseases. This not only offered an opportunity for us to make early diagnosis, to be able to offer them simultaneous immediate treatment, and also to provide for them a better linkage of care. We had communicable disease investigators who typically work off-site at the Department of Public Health. They were deployed to be with us on site at ARMC. They were able to contact the patients immediately. They were available during business hours for consultation. I think this award could not happen if we could not collaborate with public health.
I'm Dr. Rodney Borgia. I'm the chairman of emergency medicine at Arrowhead Regional Medical Center. What we discovered when we started testing is we had a very large number of patients with diseases that in the past had almost completely disappeared, like syphilis, that our positive rate was in the 4 to 5% rate of randomly screened patients. And for patients with syphilis, oftentimes you don't know that they're infected, and they have late complications that pop up years or sometimes even decades later. So it's really important to get them diagnosed and into treatment so that you can avoid some very important problems. Also, women of childbearing age, if you have untreated syphilis during pregnancy, it can be catastrophic for the baby. So early diagnosis and treatment is really important. And also for hepatitis C and HIV, similarly, diagnosis and treatment are really important. And the only way to do that is through screening. For those three diseases in particular, we have the navigators working on that. We also have them working with gonorrhea and chlamydia. And we've been able to show through this navigation that the rate in our community is actually dropping, I think because of our intensive diagnosis and treatment.
I think that really potentially solves a lot of the barriers that the patients face, right? So we're cutting out time, we're cutting out the need for them to seek additional care. We're cutting out time for potential for them to transmit the disease to others in the community.
We could not be more proud of the relationship between Arrowhead Regional Medical Center and the Department of Public Health. I'd like to thank so much Dr. Sharon Wang, Dr. Carol Lee, Dr. Rodney Borgia, and all those that have been involved in making this program a huge success. I'd also like to thank the California Association of Public Hospitals and the Safety Net Institute for allowing us to highlight and showcase the great work that our teams are doing on reducing our communicable diseases within San Bernardino County.